If you have problems with stretch marks, don't stay quiet. There's actually a lot of treatments that are available for you. Stretch marks is actually, like the name itself, a marks that form on the skin. If you have sudden abrupt changes, whether sudden increase or sudden reduce in size, can cause you to have stretch mark. I will share more tips on how you can reduce the formations of the stretch mark and more in depth on what kind of treatments available to help you. If you would like to ask further questions, you can comment down below. If you would like to see me live, kindly join me on my Facebook Live. If you have problems with stretch marks, don't stay quiet. There's actually a lot of treatments that are available for you. Stretch marks is actually, like the name itself, a marks that form on the skin. If you have sudden abrupt changes, whether sudden increase or sudden reduce in size, can cause you to have stretch mark. I will share more tips on how you can reduce the formations of the stretch mark and more in depth on what kind of treatments available to help you. If you would like to ask further questions, you can comment down below. If you would like to see me live, kindly join me on my Facebook Live. If you have problems with stretch marks, don't stay quiet. There's actually a lot of treatments that are available for you. Stretch marks is actually, like the name itself, a marks that form on the skin. If you have sudden abrupt changes, whether sudden increase or sudden reduce in size, can cause you to have stretch mark. I will share more tips on how you can reduce the formations of the stretch mark and more in depth on what kind of treatments available to help you. If you would like to ask further questions, you can comment down below. If you would like to see me live, kindly join me on my Facebook Live. Hello, good evening to all. My name is Dr. Ian. I'm from Anahu Clinics. I'm an aesthetic physician, and we have a special interest in body aesthetic. 大家好，我是 Dr. Ian，来自 Anahu Clinic。
你要解释一下他们你的什么声音这样子。
今天我的声音有点沙哑。I have a bit of problems with my voice. I have a bit of hoarseness of voice. That is why you can see me and hear me talking with this type of sexy voice today. I'll try my very best to explain to the audience in front of the laptops, in front of your mobile phone. I'll try my best as much as possible to share the information to all of you so that you at least you gain something from tonight sharing. Welcome all to Anahu channel, and also thank you very much for spending your lovely Thursday evening with me tonight. Today we're going to talk about stretch mark. As you all know, I will mention what is actually a stretch mark, how it actually developed, and why someone's get more in terms of stretch mark, and why some other people do not get so much of stretch mark, and where does it in our body, which part of the body it occur much more often, and how that, and if there any treatments available to actually help in terms of to reduce the appearance of the stretch mark, or even get better or things like that. And last and not the least, I will tell you a little bit and share interesting information regarding the myth behind all these stretch marks that are going on in the social media, or in the or your parents or great grandparents will tell you about the myth, how you can cure it, or your friends tell you you can put something on and you can actually benefit from it. I will go through with this with you, and if you have any questions, please kindly put down your questions under the comment box below and post the questions to me. I'll try my very best to answer all your questions. If I do miss it or things like that, I will, after I off it offline, then I'll try to answer you in the comment bar below. All right. Here we have a contest for our sessions for tonight. we will come up with 500 ringgit treatment vouchers that we have for 4 of it. I would like you all to kindly share these sessions to public, and like our Facebook page and Who channels, and ask questions as much as questions you would like under the comment box below, and we'll announce 4 winners at the end of our sessions today. All right. Okay, first questions. Will stretch marks appear once you gain or lose weight? This is the first question I would like to open up to the audience. Will stretch mark appear once you gain or you lose weight? The answer is A, yes, or B, no. You can kindly put down your answer in the comment bar below. Okay, I would like to repeat again the question. Will stretch marks appear once you gain weight or you lose weight? If the answer is yes, then you write A. If the answer is no, kindly write B. We can see here some most of the answers are A, yes, stretch marks. A lot of you write A, but let me tell you the answer, okay? Oh, our host, maybe we can tell you a bit later. I'll explain to you why I'll give you the answer, not A, or why the answer is B, or things like that. I'll let you know in a while later. Okay, now first off, before we proceed and I tell you the answer, maybe you can get the answer from my video I'm going to show you right away. Kindly watch the video. Stretch marks is actually, like the name itself, a marks that form on the skin. If you have sudden abrupt changes, whether sudden increase in size or sudden reduce in size, that can cause you to have stretch mark. When you overstretch your skins up until a certain limit, cause the ruptures of the elastins and also the collagen band in the skin. Some may have very bad scarrings over whichever parts that the stretch mark happens to have. That can cause emotional disturbances like loss of confidence, the self-esteem. Okay, I don't know whether you get the answer from the video that I just showed you or not. To answer the question, will the stretch mark appear once you gain weight or you lose weight? Not necessarily when you gain weight or you lose weight, you will develop stretch mark. Why do I say so? You need to stretch your skin beyond the elastic capacity, then only stretch mark will happen. If you stretch it before it goes away or beyond the elastic capacity, the skin still can shrunken back to its original size, still can shrunken, then stretch mark will never happen. If you stretch it beyond that and the elastin fibers is already torn, the collagen fibers is torn, then you will develop stretch mark. Then for the answer, for the question just now, the answer is no, actually. If you stretch it beyond, then only stretch mark may happen. If you stretch it not beyond the limit or capacity of the elastin fiber, stretch mark will never happen. That's why some people, when they pregnant, they will have stretch mark. Some people, they pregnant, they will have stretch mark, some will never have stretch mark. Why is it so? Because of what I just mentioned to you. If you stretch beyond the skin capacity, the skin elastic capacity, then stretch mark will happen. If it's not, then it won't happen. Later I will explain more. I will give you a scenario. Why do I say so?
But before that, what is stretch mark? Maybe doctor can elaborate more.
Okay.
How does it happen?
Okay, stretch marks is also a type of scarring on our skin. It's almost like an acne scar. Stretch marks, it happens because, like I mentioned to you, there's this sudden abrupt changes in the skin when the skins are being stretched in a very short period of time and beyond the elastic capacity, then stretch marks may happen. Then when it happens, then you will have, depending on the durations of the stretch mark, then we can actually categorize it into a new one or the old one. Then whether stretch marks can be physically dangerous, some of the questions people will pose normally to me: is it dangerous? Is it is infectious or not? Can it spread to other people or not? And will it harm my inner parts of my organs or not? No, actually it's no. It actually appears on top of the skins only. It doesn't affect your inner organs or other parts of your body. It only affect the areas that stretch marks appear. And the only things it do harm to the patients is harm mentally. When patients, some stretch mark can be very bad. When very bad, it can be disfiguring. When disfiguring, it can cause a mental trauma to the patient, and they will have low self-esteem and they are not confident towards the body part where have stretch mark. That's why some patients, when after delivery and they develop stretch mark, they dare not go and dare not wear bikinis anymore because it can show the ugly parts of the body. That's why the self-confidence will go down and they are not happy with that. And to tell you that, a lot of people just take it as it is. It's kind of like a natural processes that happens, then they just keep it to themselves. And they think that there's nothing can be done on the stretch marks that they are suffering. Actually, no, don't stay quiet. There's actually treatments available that actually can help those of you that are suffering from stretch marks.
Doctor, just now you mentioned about the abrupt changes of the skin, so there's a development, lead to development of stretch mark. How abrupt is the changes, or how fast the changes that I will actually, lead to stretch mark development?
Okay, just now like I mentioned, you see the video also, there's abrupt changes. For example, I give you an example. If a pregnant lady, when it's a 9 months of pregnancies, right? Initial part, the first trimester and second trimester, the increment, the abdomen stretches getting bigger is a very slow process. But when women enter the third trimester, meaning to say the end of the pregnancy period, that is when the enlargements of the abdomen will be very, very significant. During that moment, roughly about month 6, month 7, the abrupt changes from 7, 8, 9, that period of time will do a very much changes towards the skin. And that is when the abrupt changes of the skin happen. Stretch marks happen during that particular moment.
Same thing to those like a yo-yo body, suddenly gain weight and lose weight in a very short time, right?
Yeah, exactly. Not only that, when you gain weight, then only you will develop stretch mark. When you have a very big size of the body and suddenly you think of, okay, I want to do diet program, things like that. I want to shrunken my body. And a sudden abrupt changes, a shrunken, also may cause you to have stretch mark over your body. And stretch marks can happen actually to everybody, whether you are male, whether you are female, whether you are young, whether you are old, you still can develop stretch mark. It doesn't choose whether you are male, you are man, or you are women. Actually, it can affect all. For men, normally what we see, especially those are going for those the weightlifting, they want to gain, they want to bulk up their muscle, and when you can see the stretch mark always happens over the pec region and over the deltoid region. These are the common areas where you can see the stretch mark in terms of male patient. For women, normally it happens over the breast region, over the abdomen, over the thigh, and over the buttock region, some over the inner arms also. These are the areas that commonly affect a woman, and also definitely some of the males also you can have if you have a sudden increase of the size. Okay, I would like to talk about what I mentioned. I love to give example to my patient and let them know why stretch mark happen. And hopefully you can see the rubber bands that over, I have it in my hand. Assume this rubber band is our skins, our skin, you can see, right? These are two similar rubber bands that manufacturers in the same factories from using the same materials and from the same batch. If let's say I pull it and I let go, this rubber band will go back to its normal size, its original kinds of the shape. But if I pull it as much and beyond its capacity, what do you think this rubber band will happen? It will lose its shape. It won't go back to its normal shape like just now already. That's why I pull as much as I can. It may break. Some of you in front of the camera might be afraid that I might snap it or things like that. I myself also a bit worried that I might snap this rubber band, but I just want to demonstrate to you what will happen if we stretch our skin beyond its capacity. It will lose its structures. Where you can see just now when I hold up, it's similar inside, but now you can see it doesn't return to its original size already. And this is what happens towards our skins also. It lost its elastic capacity and it couldn't return to its normal size anymore. And this is where stretch marks happen. This is that's why when you stretch, if you stretch your skin, if you're pregnant with a singleton baby, only one baby in your womb, you stretch it, then nothing will happen. If it doesn't go beyond the elastic capacity of your skin, if you stretch it, then when you release it, it will go back to its original size. But if let's say you're pregnant with a twins, or you're pregnant with a triplet, or even quadruplet, 3 babies or 4 baby or 5 baby, you stretch the rubber band in terms of you stretch your skin like what I stretched it just now. Then when it's too much already, so many babies inside, then it lost its skin capacity, elasticity, then it becomes like that. The size will no longer. Then this is what stretch mark. This is what happened. I hope that with this, I can give you an idea why stretch marks happens in our body, why some people tend to develop it, why some patients they don't develop it. Because anyhow, anyone will also develop as long as you go beyond the skin elastic capacity. Definitely the stretch marks will happen, will develop in your body, be it you are a male, female, young or old. You stretch it over the limit, stretch mark will definitely happen.
Doctor, there's a questions from Lisa. Maybe you can read out the questions.
Okay, let me see. Okay, can stretch mark be prevented during pregnancy? Okay, stretch marks can be prevented if, like I mentioned to you, depending, because every individual, we have a different qualities of skin. Seems like I give examples like rubber band. Rubber band, these rubber bands is the rubber bands that we usually use to tap our food. If you use a rubber band that industrial usage one, the qualities of the rubber bands is better, is thicker. That's why when you stretch it, it can stand the force of stretching much more better than this type tapau's rubber band. Our skins also, different individuals have different types of skin quality. Some people may develop it more easily, some may not develop so easily. And pregnancy can cause or not. Pregnancy is one of the risks and the most common cause of stretch marks in women. To prevent it, if you are to choose to you can know that if you are to say, let me put it this way, if you are going for the IVF treatments, to only pregnant with one baby or to pregnant with the twins, if you are to choose to pregnant with only a singleton baby, the risk of you developing stretch marks will be much very more reduced. If you choose to pregnant with a twins baby, the risk of you developing or stretch mark develop in your body will be a bit on the higher side. To prevent it, then maybe a single baby will be a better choice for you to choose, so that you reduce the risk of developing a stretch mark. The second question is how to prevent stretch marks from getting worse. Okay, this one I guess I will talk in much more details later on, because I'll tell you how actually we can actually try to reduce the risk of developing stretch mark. I will share later parts of my presentations later. All right.
Next question, doctor. If you got it, maybe because we did something wrong.
Okay, that's a question. If you have stretch mark, is it that you did something wrong to your body? Actually, no, it's not that because you did something wrong. There's nothing that you did something wrong with your body. It's just that the parts of the body is overstretched beyond its limit. It's beyond its limit. It's nothing wrong. If you really take good care of your diet, then you don't have a yo-yo kinds of body, the weight gain and weight reduction, then the risk of getting these stretch marks will be much more lower. It's not that you did something wrong or what. If you stretch it too much, definitely the stretch mark will happen. There's another question, Dr. Ian, what makes stretch mark show more? I try to figure out what you are trying to ask me. What makes stretch mark so small?
Right. very visible. Or,
Okay, stretch mark. Later I'll talk about that. I will just share with you. Stretch mark actually we can divide it into two types of stretch mark. We call it new stretch mark or old stretch mark. How we know that it's new than stretch mark? It's like we look from the color. The colors looks a bit more reddish. Sometimes it's more purplish. For old one, normally it looks a bit pale. It looks a bit whitish or silverish. This is how we can differentiate between a new and an old one. If you if let's say you have a stretch mark before already and you develop a new type of stretch mark again, definitely the stretch mark will be more on your, if let's say on the abdomen region, there will be more. If I can answer the questions that it can be more or not, can. If you repeatedly develop this stretch mark, then definitely you will develop more and more with the new one and the on top of the old stretch mark. Okay, now I think I show you a video of what I just mentioned to you to differentiate between the new stretch mark and also the old stretch mark. Well, basically there is two types of stretch mark, the red stretch mark or another one white stretch mark. Red colors one is a new stretch mark. Why is it red? Because the overstretching of the skin, the vascular lesions below the skin. That is why it looks reddish. Sometimes it looks a bit purplish. White color stretch mark is the old stretch mark. From red, over time the colors will fade and it becomes whitish, or sometimes it's almost the same colors like your skin. Sometimes it may fade even further, then it looks a bit pale, I would say. Depending on which colors, actually can tell us some information. The red stretch mark or the new stretch marks will be more responsive to treatments as to compare with the old stretch marks, the white color stretch marks. Okay, now that you know that the stretch marks can be differentiated between the red one, or we call it a new one, and the old one is a white color one. How another way I can give you a rough idea how you can differentiate it. You run your finger through the stretch mark. If you run the finger through the stretch mark, and one is you can judge from the color. Second, when you run your finger through the stretch mark, it feels smooth, as if like it's a same level with your skin, or it's a bit raised, then that normally is a new stretch mark. For old stretch mark, when you run your finger through the stretch mark, normally you're a bit depressed. You're a bit depressed, meaning to say it's not smooth and it's not at the same level at the surrounding of our skin. It looks a bit depressed. When you run your finger through, it looks a bit depressed. That is another way of how you can know it's a new one or it's an old one. Then why is it red? It's because of the red vessels running, because the skin are just recently being stretched, and the vessels beneath the skin are very visible. That is why it looks reddish because of that. And sometimes it may feel a bit itchy and feel a bit irritated one. But good news to you is red stretch marks are more responsive to treatment compared to old stretch mark. In other words, if you come for treatments earlier, then the outcomes you'll get better outcome. If you come a bit later on, yes, we can still do something about it, but it's not so responsive to treatment as compared to those new stretch marks. And my advice to you, if you have it, don't keep it silent. Seek treatments from your aesthetic doctors. Ask what type of treatments available, and actually they can do some things to help you in terms of improve the appearance of the stretch marks that you are having.
how about some people that will think that they want to have maybe 3 babies, so they like kumpo until the third child, then they only treat the
Okay, there's questions from the floor on live here. The questions is, if a woman, they already have a family planning and she and her husband plan to have 3 kids within their lifetime, Then they say, if I would do it, can I just keep after the first baby, second baby, the third baby, after the process, then only I'll do treatment? Can or not? It's actually vary to each individual. If like what I mentioned just now, if the earlier you seek treatment, the better result you will get. If you keep it, because when you keep it, if the first child and your last child, the gap is 10 years between that, then will be the old one will be 10 years old already. Then this one is a new one's coming. Then to treat a 10-year-old marks will be a bit challenging. If you are to treat it every time when it comes, then we treat, then chances of the 10 years old, you keep it until so long, it won't be so difficult to treat. And the quality of your skin will get better. Instead of you wait later until 10 years later, then only you start treating your stretch mark.
Doctor, is it possible that the new stretch mark actually grow on the old stretch mark, the new one?
Okay, the question is, can a new stretch mark appears on the old stretch marks or not? It can, because it's depending on how your skin is being stretched, then there is a way of skins being stretched one. There's a pattern to it one. Then it can happen on top of the old stretch marks also. That is why, like acne scars, if you have acne scars already, and acne, it loves to happen over the same area again and again. That's why always the T-zone area you will develop the acne. When you develop acne, then if you that's the mark, if the scar is already there, and you have recurrent acne happens over the same area, then you can see the scars will get deeper and deeper, deeper and deeper. This is what happens in terms of the stretch marks also. Like I mentioned earlier in our sharing sessions just now, stretch marks is also a type of scar. It's just that it 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 happens because of the skin stretching, not because of the infections and inflammations happen like acne. It's a different pathology, but it's also a type of scar. All right, I think we can answer questions.
We can answer
Few questions.
Actually, there's a very interesting question just now that someone asked that could it be from genetics?
Okay, there's a question asking, could it be from genetic? Does it, or does it happen in puberty? Actually, there's a role of genetics in that in this stretch marks development. There's a studies being done, and it runs in the families also. If your parents have it, your siblings have it, more likely you have it. Genetics play a role, and during puberty time, this is the times when children grow. Nowadays, when we see the trend, now kids tend to grow really quick and really big because of the food they are taking. They take a lot of, I would call it not kind of so healthy food, those processed food, those fast food, those junk food. This will make the body suddenly grow very big in a very short time, and this will also cause that the child developing stretch mark. Puberty is also one of the cause of developing stretch mark in our life. Not only during pregnancy, during puberty is also one of it. There's a question, why skinny people also have a stretch mark? Even all the while before this they are skinny.
Yes. Some people they might have. Yes, I saw it before. Very skinny people, but they have stretch mark.
Very skinny people also have stretch mark. Meaning to say they don't have, they never gain weight.
They never gain weight.
Okay, they are stretch mark happens. One is because of sudden changes of the skin. Another condition it may happen is that there are underlying medical problems that patients are having. For example, if the patients have some cruising syndrome, meaning to say it's a disease that causing the body to produce a abundance of stress hormones called cortisol or cortisone. When these hormones are too much in our body, then it can also change the quality of the skins. And the skins are very, very easily to develop stretch mark. Another condition, if those patients that who love to use, or because of the disease conditions, make them need to use very often steroid cream. When you apply very potent steroid and for a very long period of time, the skin over your body can develop stretch mark, even more prone to develop stretch mark and easier to develop stretch mark, because this medication make the skins thinner, and the quality of the skins also affected because of usage of this type of medication, because of the steroid cream and also the medical condition. It could be what happened, skinny persons or things like that. It could be have an underlying problem, not only cruising. There are some Marfan syndrome also can lead some can contribute to this one also.
Doctor, I have one very interesting question
Yeah.
for me. Why actually stretch mark doesn't appear on our face or doesn't appear on our hand?
Okay, there's a question, why stretch marks don't really happen over our face, but only more towards, like the diagram shows on the video and data we put on to the screen. It happens more over the breast for women. Then for guys, if you train out, bulk out your muscle, appear over the deltoid, the pec major muscle, abdomen, thigh, things like that. Because these are the areas can easily expand. But over the face, you can't really expand your face too much. There's certain limitations for expanding. But breast, but tummy can expand very big one. The thigh can expand the expansion. That's why the skin can get really stretched. Your face, unless you have certain condition, you blow up your face until a very big, then maybe that will also happen. But these are the area of the skin that normally won't get so much of expansion. That is why it never occurs so much in this other area from what I show you just now. The common area are those areas that I just mentioned. Face, you rarely see. It happens over the back of our palms, our hands here, rarely, or on the dorsal part of our feet. You rarely see this one, because these are the area you can't really get too much of expansions one. Yeah. Okay, we put out another questions for our audience to answer, to make it more lively. We have the interactions with our audience. Questions number 2: can stretch marks be removed permanently? A is yes, B is no. Let's see.
You will review the answer later.
I will review the answer later. I hope the audience can share your answer with me. Then
Can
I
you
will.
repeat the questions?
Okay, the question is, can stretch marks be removed permanently? The answer whether is A yes or B no. You actually, audience, you can ask me any questions that you want, and if you can ask me in English, if you are not comfortable, and you can also ask me in Mandarin, or if you can't, then you can also ask me in Bahasa. If I'll try to answer you according to the language that you ask. If you ask me in Bahasa, then I'll answer you in Bahasa. If you ask me in Mandarin, then I can answer you in Mandarin.
Doctor, apa itu stretch mark? Apa itu stretch mark? You can answer in Bahasa.
Answer, apa itu stretch mark? There's a question to Bahasa. Stretch mark, also I don't know how to mention it in Bahasa. It's because the kulit being stretched until is over its limits already. Meaning to say, itu kulit kita tarik or expand over its limit. Lebih daripada dia boleh expand. Itu sebab stretch mark happen. Bahasa Iban, sorry, saya tak boleh. Dengan suara seksi macam ni, lebih baik saya jangan cakap bahasa Iban.
Doktor, 什么是 stretch mark? OK，
OK， 华语呢 stretch mark 是叫妊娠纹。I hope that I pronounced it correctly. My Mandarin also cukup makan only one. It's not so good, but for normal conversation, I think still can make it. It's a 妊娠纹。It happened. 它为什么会发生呢？是因为我们的皮肤，当我们一个很短的时间，我们那个皮肤被拉扯 then 它的里面的那个 fibrous band 呢，它的 elastin band 已经是被损坏了，所以就好像刚才我给一个 example， 如果是那个 rubber band 呢，你扯得太厉害、太大的时候，它不能回去它原本的那个形状了。如果你扯一点点，它还是可以，你扯还没有 over 它的 limit， 那个 rubber band 还是会回去它的原本的形状的。但是如果你扯到太够力、太多的时候，那个塑胶它这个 rubber band 塑胶，你们叫塑胶吧，它不能回去它原本的那个形状，它就 lost 掉它的那个 elasticity 啊。那就是说，就是为什么妊娠纹会发生在我们身体的，那个 condition 就是这样。
Doctor, you can review the answer.
Okay, the
Can stretch mark be removed?
okay, can stretch mark be removed permanently? The answer is actually no. Answer is B. Is no. What can we do actually? Stretch mark is like a scar, like I just mentioned. It's a type of scar. We can all the treatments available. We can actually improve the appearance of the stretch mark or appearance of the scar, but we can never totally or permanently remove it straight away. Remove straight away, to what I'm understanding is, it from there's a stretch mark. When you do treatment, the stretch marks go or gone. You go back to the before stretch mark happen or the scars happen. It can't be like that. Once stretch marks happen, then it will be there. It's just that when we do treatments, we go to seek medical attention and do some treatment. It can improve the appearance of the scar. The scar doesn't look so bad and it doesn't look so disfiguring, and that can improve the quality of life of the patients, and they can get more confidence of their body.
So can we say that actually just the treatment only can make it less visible?
Yeah, all the treatments available for the time being can make the scars look less visible and make it more appealing, and the patients can accept it better, rather than it's like acne mark. When we do it, we make it less deeper, make it more smoother, improve the scar as much as we can. But to get a scar from a scar to become no scar to back to a normal baby skin is impossible.
Same to stretch mark.
Same goes to stretch mark.
Okay. Doctor, there's a question from Yet Chin Chin.
Actually, like I mentioned just now, stretch marks can happen in all ages, whether you are young or you are old, whether you are male or you are female. 14 years old can be treated or not.
I think what she means is the stretch is already 14 years.
Oh, okay, 14 years old of stretch mark, can it still be treated? The question is to be like that. Yes, you can be treated, still can be treated. It's just that what, like I mentioned just now, old stretch mark is a bit more tricky. Then the treatments that are available that we use, you need to be a bit more aggressive in terms of to improve the appearance of the 13 years old stretch mark compared to a new version of stretch mark. We need to use a bit more invasive, I would say invasive kind of treatment, rather than non-invasive, for you to get a better result of improvement from the treatments itself. Yes, definitely you can do something about it. How about stretch marks on breast? Can be removed. How to do so? Stretch mark is like stretch mark over the breast, over the abdomen, or over the type, whichever region. The treatment options is also almost similar, but the difference between the treatments is just the whether it's an old one or it's a new one. If a new one is just a vascular, then we can use a laser actually to lighten, to improve the appearance of the vascular components of the scars itself. If the stretch marks are a bit older, like I just mentioned, if it's too old already, we need to use a bit more aggressive treatments, need to use a bit more invasive treatment to treat that particular scar, because that scar is already a atrophic kind of scars already. That is why it gets a bit sunken. There's a bit depressions already. We need a treatment to be a bit more aggressive to stimulate the collagen production, to stimulate the fibrous production, so that produce more, so that can improve the scar appearance. Okay, now since I'm talking about the treatments, why not we have a look at the pre-recording video where what types of treatments actually available currently to help you if you have stretch marks. There are few treatments that actually we can help the patients to improve the appearance of the stretch marks. First of all is the light therapy or laser therapy. It can be divided into ablative or non-ablative lasers. For ablative laser therapies is the erbium yak laser therapies. Non-ablative laser therapies that are normally used dual yellow. The lasers also can help out to firm up and tone up your skin. Another types of treatments, microneedling treatments, is actually very fine needles that deliver radio frequencies, energies into the skins, promote the collagen's production. The third types of treatments that we are using radio frequency treatments in our clinics are normally use venous legacies to improve the appearance of the scars. Actually, the aims of all the treatments that I mentioned just now is to promote fibroblasts, more collagens and elastin in that treatment area. With all this happens, that it can help the quality of the skin to improve, and the appearance of the scars may also get improved. The treatment is not to totally cure the marks or the scars, actually to make it less visible, so that it can improve the confidence of the patients and the self-esteem of the patient. That is our aims of the treatments. Okay, before we go in depth and to talk about more, let's audience, today we have a contest going on. All you need to do is to like our Facebook page and Who channel. Go in and like, share to the public, so that more and more people can actually benefit from these sessions that I'm sharing. I have no voice, but I'm still stay here and talk to you. Hopefully that more and more people can benefit from this one. Basically, I just want to share my thought and to help to share this information for the audience, so that you know that actually this is not a natural process. Actually, it's some things that actually there's a treatments for it. Don't stay quiet, and there's a treatments available for you. And what you need to do, like I mentioned, like our Facebook page, share, ask questions, and we'll have a very interesting price for you. Is a 500 treatment vouchers where you can use it in our clinics. We'll have 4 of them. We will choose the winner at the end of sessions today. Kindly do so. And with that, I will go on to see whether there's a new questions that I'll try to answer as much as possible before my voice go totally out. Okay, this one, there's a question. This one is very interesting. Is there any supplements or skincare that can treat stretch marks instead of going for treatments laser? Okay, once you develop stretch marks already, there are hardly any things that you can do to actually to eliminate or to actually to reduce the appearance of the scars itself already. But if before the stretch marks happen, is there any things that you can do to improve or cut down the risk of you developing stretch mark? Yes, there is a method or some things that you can do to reduce the risk of you getting stretch mark. From here, if you already developed stretch marks already, then you need to do something about it. Either lasers, it's a non-ablative type, like the video show you, a non-ablative. We use laser, yellow light laser. We can use a heat therapy laser, or you use invasive therapies like micro needling to actually improve the appearance of the scars.
Doctor, actually, what's the aim to for the all the light or laser treatment? What
Okay.
we aim to?
Okay, for the aim, if we are using, if you are having a new stretch mark and the stretch mark is still red, the purpose of the lights is to actually to calm down the vascular components in the scars itself, in the red scar itself. When we do, actually we constrict all the vessel inside there. When you constrict it, then the marks will not be so reddish anymore, and we can improve the appearance of the red scars. If your scars is already an old type of scars, the treatments per se, the treatments aim are to improve the vascular, what we call angiogenesis, improve more vascular production in that particular area. With that, more collagens will be produced, the fibroblast tissues, the fibroblast cells, then the collagens will be more abundance in that particular area, and they will improve the quality of the skins in that region. That's the aim of the treatment, because of the heat itself, because of the injury into the skins itself, and can promote all this from happening.
I think there's a question. How
Yeah.
any preventions you from getting stretch mark? So you mentioned some. Anything that we can do actually to prevent it?
Okay, to prevent it from happening, like I mentioned, the way you can prevent it, first of all, don't allow the area of your skin to overstretch. If you overstretch it, whatever cream you apply on your tummy, for example, on your tummy, you can put cream, you can put lotion, until an extent you can even put oil onto your tummy. If you stretch it over the limit, stretch marks will still happen. Okay, that's the first thing. To prevent it from happening, what you can do actually before you if, for example, if a lady, they would like to get pregnant, and what can they do to prevent the stretch mark happening? First of all, you can apply a little bit of cream, the hydrations to your skin, so that can hydrate your skin. You can put it the hyaluronic acid to hydrate, or you can use some things it's more richer. You can put cream, or you can put lotion. Some patients may put some oil. Then you can do it. What is the main purpose of that? Actually, is only to hydrate the skin. Second, what actually you can do, you need to supplement yourself with good nutrients. For example, vitamin C is one of them, with the zinc, the silicon, then amino acid, and vitamin D. These are the nutrients that the body needs, so that the skins can produce much more collagen. When your skin can produce much more collagen, then the risk of you developing the stretch mark later on will be a bit lower. The third one, what you need to do, you need to drink more water. You need to hydrate your body. The third one is to maintain a healthy weight, so that your weight don't go like yo-yo, up, down, 100 kilo, down to 70, 50 kilo, then go up again. That is when stretch marks can happen. That's why you need to really improve on that to reduce the risk of stretch mark. Okay, another questions to ask, can topical cream and traditional remedy works on stretch marks? This is what I just mentioned just now. Topical cream, if the stretch mark haven't happened, then it can do a bit of help. But if once the stretch mark is already there already, then this topical cream or traditional remedy or what, so it doesn't really work so very good on the stretch mark itself already. You need to use some other modalities to actually improve on that already. Before it happened, yes, you can see some improvement. When it happened, not so much you can do on in terms of you using cream. Then will stretch marks heal over times on their own? Stretch marks is not to say they will heal. It's just that it will look, the colors will start to change. From initially when they are red and very purplish, then the colors will kind of tone down, then become silverish, looks a bit whitish and become pale. And sometimes it can be even lighter compared to our surrounding skin. That is how the progress of the stretch marks itself is. Over the times it can look almost the same like our skin color. That is why it looks not so visible when you go a bit older, but you go nearer and you can see the stretch mark is still there. It's still there. It won't heal by itself. It's not like the stretch mark open up already. Over the time the stretch mark just close it back like that. No, it doesn't work in that way.
Doctor, you can read the questions from the chat box. No questions?
The question.
Any supplement or skincare product, after the treatment? There's a question from Marvin.
There's a questions from Marvin. Let me see. There's a question from Marvin. Do patients need to take any supplements or skincare product to get better? Like I just mentioned to you, supplements play a role, but a healthy and a well-balanced diet is much more important. You need to take a healthy and balanced diet. If with that is not enough, then supplements come into play already. And what type of supplements you can choose to improve? Now we are mentioning about how to improve the quality of the skin, how to improve the collagen production, what type of minerals or what type of nutrients you need to improve on that. Like I mentioned just now, vitamin C, the zinc, the silicon, the copper, the amino acid, like glycine, like lysine, proline, this type of amino acid, and some say vitamin E also can help in terms of production of the collagen. That's why you need to source this type of supplement. If you can't get enough from your normal diet, then supplements come into play already. If you take more on this one, definitely you help it to improve your quality of your skin. Yeah. And another questions are women more prone to stretch marks than men? Just to answer this one, it can be actually, like I mentioned just now, there's no gender bias in terms of stretch mark. It can happen in both men or women, but we see more in women. Why? Because women tends to get pregnant, not like men. Men do not get pregnant. The most you can grow fat only. But for women, throughout their life, out of 10 women, maybe more than half of it will have a family one. Then they will get pregnant. When they get pregnant, is one of the risks, and they will develop stretch marks already. That is why you see more in terms of women compared to men, in terms of developing these stretch marks. I think my sounds, the battery is like that already.
We can play your video. We can play your video.
I'll drink to clear my throat. We watch a short video. Let me drink some water. Treating stretch marks or acne scars, the concept is almost similar. We want to improve the appearance of the scars itself. Hello, how are you?
I'm good.
for patients that after first pregnancy you develop stretch mark and you do nothing about it. Then second pregnancy, over the same area, overstretch again. Then that particular stretch marks can go even bigger. What I'll help her in terms of this one, what we call red stretch mark, non-ablative laser can do, such as the dual yellow. We can lighten the color, the stretch mark, especially the red. For the white, it don't do much of improvements really. Then we need to use different types of laser, ablative laser. Those can tighten the skin. That can give better result for those white color stretch mark. Dia sudah tak obvious sangat merah already. You need a sequence of treatments. In between one treatment to another, roughly gap about 4 weeks to 8 weeks, depending on how patients react to the treatment. The purpose I'm using this dual yellow, I would like to lighten the discoloration, the red and the bit brownish color one. When it turns white, the responsiveness towards the therapy not as great as when the stretch mark is still reddish in color, what we call the new stretch mark. Then when you can see, the more I do, the color starts to lighten up already. There's a red line here, then you can see it comes down a lot. But the white one never goes away, it's always stay there. And after this, if patient's conditions getting better, and then we can go for the white color stretch mark. Hello, I'm back again, but the voice also still like that. Alright, just now when you saw the video just now, I would like to share a little bit to explain to you what is actually happened in the video just now. You see, there's two types of stretch marks in that particular types or in that particular patients. There's a white stretch marks and also there's a red stretch mark. For the red stretch marks, I'm using a yellow light to treat the patient. You can see before and after photo. The yellow light actually can lighten the color of the red color of the stretch marks itself. Once finish the treatments, then you can see the red stretch marks, the colors improve significantly. That's what I would like to show in the video just now. Another thing before we see, this is the before and after photos of the patients. The stretch marks, after you do treatments, you can see there's improvements over the stretch marks after you do the treatment. It's not totally gone. It's not totally, it's like what some questions that put up to me, can the laser or the treatment permanently remove the stretch mark? The answer is no. Even though we do treatment, you can see the appearance of the stretch marks get improved, but it doesn't permanently remove the stretch marks away from the body. All right. Okay. Let me to answer, because there's a questions coming. Why some patients tend to develop stretch mark, and when we use a certain product before we develop stretch mark, can it help or not? Let me give you an idea so that you have. If two rubber band, I have two rubber band, okay? It's a rubber band story again, so that you can understand it better. These two rubber band manufacturers from the same factory, similar and same products are being used, materials being used, and they are similar. If one of these rubber band, I put it inside my office, and another rubber bands of this I put outdoor, is under the hot sun, under the rain, and if I stretch these two using the similar force, which one will break first? Definitely the one that I put outdoor under the hot sun will snap faster compared to this one. Why is it so? Because it's like a skin. If we hydrate it better, we take care of it, it will not snap. It will not develop the stretch marks. As rubber band, it won't snap so easily. It can retain and it can endure the force of stretching. If you don't really take good care of your skin, then the risk of you developing stretch mark will be a bit on the higher side. That's why it's important for you to take care of your skin. If you don't take care to start it with, if your skin is already dry and without it's already very dry, and you also apply very often applies steroid one, and you get pregnant, for sure your skin over your abdomen will develop stretch marks very easily. If you take good care of your skin, you drink, you take supplement, enough enough good weight control, not sudden increase it, then the stretch mark will develop or not. It will if you have triplet or quadruplet or more than that. If you only have single baby and you do not stretch your abdomen skin up beyond its limit, stretch marks will never happen, right? I hope that this will give an idea to our audience, and you can take home this concept and this information and share with your loved one and share with your friends. And if your friends and relative or whoever have these problems, there's treatments actually for it. Don't stay quiet, get treatments, and you can actually improve the appearance of the stretch marks that you are having. All right, we'll we'll announce the 4 winners of today's sessions, and we'll announce it in our Facebook page, in our annual Who channel after this. All right, if you have any questions before we go, if there's a burning questions that you would like to ask me, then I'll try to answer before my voice go mute. Then then I will probably do so, because I think my sound is almost zero already.
你用生命在做那个。Any questions you want to answer?
Is there any other question? Because my side here.
Oh, is the laser painful? Maybe the last
Oh,
question. Oh, how many sessions?
Oh, there's a question asking, is the laser for the stretch marks painful or not? Depending on what type of laser we are using. If you are using the one that I show you on the video, the yellow light, actually it's not painful. It's very comfortable, I would say. It's just that you feel like I'm actually using a probe massaging over the areas that where you have stretch mark. There's another type of lasers that we use a bit ablative and use a bit of heat. Then if you are a person that heat sensitive, then you may feel a little bit discomfort in terms of you feel the sensations of heat, and you feel the pain in terms of that. I would say, and this one is very subjective. It's very individual, very individualized. The threshold of the patient, sometimes they say with this they can cope it, some they can't. But if we are using something a bit more invasive, and definitely you will feel a little bit of discomfort. But anyway, to do it, we will try to improve the sensations, the treatments sessions with our patients. We will put the numbing cream to cut down, to improve the pain, so that when we are doing the treatments won't be so painful. With the numbing cream, normally patient can actually bear with the treatment.
Okay, last questions. How many sessions of the laser?
Okay, how many sessions of the laser we need to improve and reduce the stretch marks? Actually, you need roughly about 6, depending on how severe is the stretch mark. I would say how severe is the stretch mark. It's not a single treatment and you can see the improvements really. It's single treatment or very short treatments that where you can see a very good result. One is those are the new one, the new type, the red one you can see. But those a bit the old stretch mark, then we need a much more sessions. More than 6 is normally the answer to a patient. But we need to assess the patients first. You need to go and see your aesthetic doctors or your physician, and he will tell you how many sessions that you require to improve your scar. All right, with that, thank you for staying with me with my sexy voice until now. Hopefully I answer all the questions, and if you have more questions to ask me, you can put it down under the comment bar, the column below. I'll try to explain and give you the answer after these sessions, and hopefully you gain something from the sessions tonight. Thank you very much, and goodbye.